And welcome back. In the United States, approximately 100,000 people live with sickle cell disease, with about 10% of those living actually in New York State. Millions of people do not know they have sickle cell disease because the trait usually doesn't cause illness. That's why it's important to be tested. Signs and symptoms of sickle cell anemia vary from person to person and can change over time. Joining us to share more details about this is the Assistant Professor of Pediatrics at the Albert Einstein College of Medicine and Director of the Sickle Cell Program at Montefiore Medical Center, Dr. Kerry Morrone. And Dr. Morrone, thank you so much for being with us.
Thank you so much for having me. I'm so happy to be here.
Glad to have you. When we talk about sickle cell, as we said, about 10% of people in the state of New York are really dealing with sickle cell. But for somebody who may not be so familiar, give us a background as to exactly what is sickle cell.
Yes. So sickle cell disease is a condition in which you're born with. It's inherited. Your parents will pass down two different traits, and you will have this sickle cell disease, of which there are many different types of forms. And it's a blood disorder. So what it is red blood cells typically are these nice round red blood cells. And with sickle cell disease, the cells itself turn into like a C shape when it goes under times of stress or low oxygen in your body. And this can affect your entire body. Obviously from birth until adulthood, you have this condition your entire life once you are diagnosed with it at birth. And the condition really needs to be monitored closely by a hematologist, a pediatric hematologist like myself in childhood, and into the adulthood with the adult hematologist, because there are many different complications that we have to monitor for. Patients with sickle cell disease are at increased risk for infection. They have often pain episodes because if you can imagine these sickle cells that are C-shaped, they can get clogged into the blood vessels and can cause extreme pain at times, in which our patients have to visit the emergency department. They have to be hospitalized at times. Our patients are at increased risk for vision loss, are at increased risk for having strokes. There are many different complications we have to monitor for, and it's so important that everyone know their trait status and that they know if they have the condition.
Yeah. And so when we talk about diagnosis, how hard is it to really come up with the diagnosis for sickle cell? Is it pretty easy to figure out if a person does have it?
Yeah, so now in all the states in America, at birth, children will be screened for sickle cell trait, sickle cell disease. So when the babies are first born, there's a little bit of blood that's drawn and sent to the state registry, which they can easily find out in a couple of weeks. And then as an adult or a child, if you don't know your trait status or your sickle cell disease status, you can go to your doctor and ask for a blood test. It's actually pretty simple blood test that they can just draw. And then if there's concerns, then they can refer you to a blood specialist like myself.
Yeah. Sometimes people do not find out that they have sickle cell until they encounter certain kinds of medical problems. What are the medical problems that actually accompany sickle cell?
So the most common is pain. Those sickle cells that are brought up that are abnormally shaped, they are floating all throughout your body, and they can cause pain at times in which people are under stress, if they have infections, if they encounter cold temperatures, if they get dehydrated, if they have other illnesses that are going on in their life that are also getting worse, that can all trigger their sickle cells to then misshape more and cause more symptoms. So pain is the #1 symptom for our patients. And it can happen very suddenly, out of the blue. You don't even expect anything. And then that will lead to a painful episode in which you have to go to the emergency department or you have to go to be admitted to the hospital. So it's important to monitor your own body and know how you're feeling. Also importantly, because these sickle cells affect everywhere, it also affects the spleen, which is an organ underneath your ribs. And your spleen helps protect against infections. And so the spleen with sickle cell disease doesn't function so well because those sickle cells get all clogged in there. And so you are at increased risk for infections as a child and even into adulthood. So our patients need extra vaccines. They need to see a doctor right away if they have a fever and to get antibiotics and screen for other more serious infections. There are many other complications, but just a couple of those I want to highlight is in particular stroke. So our patients with sickle cell disease are at increased risk for stroke from childhood into adulthood. And so there's certain screening ultrasounds that we do every year for our young patients to make sure that we know their risk factors for stroke. And school performance is another big issue that we want to highlight to our families to bring up to their doctors, is that if your children are having difficulty in school, sickle cell disease could play a factor in that. It can affect your brain in other ways. And so we try to support our families in many other ways. And we do screening tests for other things like your liver, your heart, your eyes, to make sure that we look for other complications with that, because it really affects every organ. And so we have to closely monitor it throughout their lifehood. So
Yeah. And so once a person is diagnosed and they do have sickle cell, obviously the question comes about treatment and cure. First, let's tackle the issue of treatment. How is it treated?
yes, so there's different treatments, and I think of it as acute treatments, like when you get sick, and then treatments for preventative measures. So when someone has a pain episode or has a fever, you have to go to your doctor right away to see if you need antibiotics, to get pain management, to get appropriate fluids. Sometimes you might need a blood transfusion. And so these are things that we do acutely. For prevention, as I mentioned, there are increased risk for infection. So we want to make sure we give the appropriate vaccines, that we give antibiotics such as penicillin in their childhood years to prevent infection. And then there are different medications that are actually now approved by the FDA for children and adults with sickle cell disease. There are 4 drugs right now that are FDA approved: hydroxyurea, Endari, Oxbryta, and Adecvio. I would say hydroxyurea is the longest studied, but we can start as young as 9 months to 12 months of age. The other ones are a little bit newer, but very exciting that we have new FDA approved drugs. And there's different indications for all of them. Some of them are by mouth, some of them are through an intravenous way. But there are different treatments now that we can provide for our patients to help keep them healthy from the complications of sickle cell disease. Because of course we have to treat when they're acutely ill. We also want to keep them as healthy as we can to keep them out of the hospital. In terms of cure, the cure right now, the only cure that we know works is a bone marrow transplant. And a bone marrow transplant is basically these cells in your body, these like fatty cells in your body, they end up getting replaced by someone else's bone marrow, because the bone marrow itself has lots of different cells, your red blood cells, your white blood cells, your platelets, and we have to find an appropriate match so we can replace your bone marrow, which makes all these different cells, with someone else's bone marrow. And right now, a brother or sister match bone marrow transplant is sort of the standard of care. If you have a brother or sister match, that is something I would definitely talk about with your sickle cell doctor, if that would be the right treatment option for you. And there are other studies ongoing to look at if there are other matches from other people that are related or unrelated, as well as gene therapy is also being investigated right now as a different option. So there's a lot of ongoing investigation into different therapies.
And we know the big conversation right now is about the vaccine and how people are encouraged to get vaccinated. How does the vaccine play out in the life of those who've been affected by sickle cell?
Yes, so we encourage everyone who is eligible for the vaccine to consider getting the vaccine, because we know that patients with sickle cell disease are immunocompromised, and so they are at increased risk for complications from getting coronavirus. We recently published a paper of our patients in the Bronx and showed that there was about 4 times increased risk of being in the emergency department if you had sickle cell disease and coronavirus, and 7 times increased risk for being hospitalized. So those are all complications we want to try to avoid for our patients. The Sickle Cell Disease Society of America also agrees that patients that are eligible to receive the coronavirus vaccine should definitely receive it, and that mask wearing, hand washing, all the appropriate measures to keep yourself safe should continue. And we want to make sure that our patients with sickle cell disease take the appropriate precautions, because getting sick with sickle cell disease is a very different situation than someone who does not have the disease.
Yeah. And so curable, is that yes or no?
So there is a cure for some patients with sickle cell disease if they have the appropriate donor for bone marrow transplant. Unfortunately, not everyone has the appropriate donor to do a brother or sister bone marrow transplant right now. And so that is why there are other research studies looking at bone marrow transplants from other people, like if you're not related, or if you're related but are not a full match to your immune system. So those are all studies right now, as well as gene therapy is an ongoing study. So we're hopeful that there are more cures for patients that don't have a brother or sister match, but that's the only known transplant that is safe.
Yeah. Well, Dr. Kerry Morrone, thank you so much for being with us, sharing so much about sickle cell. Very important that we raise awareness, and I think we did that today. So thank you for being with us here on Open.
Thank you so much. Appreciate.
All righty. Well, we want to let you know if you want more information, we encourage you visit the website at einsteinmed.org and montefiore.org. We do have more show coming up, so don't go anywhere. Open continues right after this.